You're listening to the Nutrition Experts Podcast, featuring guests who take the scientific talk about food and break it down for practical use. You've heard the phrase, "you are what you eat." Come find out what that really means. Experience conversations with experts in the field of nutrition and understand the power of food for our health, well-being, and beyond. Now, here's your host, registered dietitian and nutritionist, Mathia Ford.
Hi there, it's Mathia. Welcome back to the Nutrition Experts Podcast. The podcast featuring nutrition experts who are leading the way using food starts today, right now, with our next guest. It's great to have Brittyn Howard on the show today. Brittyn, welcome to Nutrition Experts. I'm excited to have you on the show and share your expertise with my tribe.
Hi, Mathia. Thank you so much for having me. I am so grateful to be here.
Oh, I'm so excited because we're going to talk about something that is, you gave a presentation in our local dietetics meeting, and I was so interested, even though I don't necessarily deal with this on a day-to-day basis, just how much impact nutrition can have in this process. What made you interested in this topic?
So I am a dietitian. I specialize in autism spectrum disorders, and autism is very deeply rooted and I think who I am really. So my brother was diagnosed with autism when he was 2 years old. And I mean, that really shaped our family. So my mom was actually a psychologist before he was diagnosed, and she already specialized in autism spectrum disorders. And so before he was born. And so she was able to recognize the early onset of autism. And this was around when he was 2 years of age, and know what therapies to do for him so that he could have the best outcome. So my whole life, he's just a few years younger than me. And so my whole life, I've, seen how he's grown up, how different therapies have affected him and helped him, and how nutrition has played a part in that. So whenever I got into nutrition school at OU Health Sciences Center, I knew very quickly that autism was an area that I really wanted to focus on because of my personal experience and, their lack of dietitians in this field. So definitely, it's all rooted with my brother. His name is Barrett.
Oh, that is awesome. I think we can really, when we know something inside and out, we can do such a great job and help so many people when we have been in those shoes and understand it so well.
I definitely agree. I feel like a lot of people that do have a personal connection with some, disease or health, issue just become so passionate about it, and it becomes your whole world. I mean, for me, it's my private practice is all about autism, but I'm always advocating for autism. I mean, it's a huge part of me and my daily life. So definitely becomes something, more personal than that too.
So for the listeners who may or may not know, I'm sure we've all heard of autism, but can you talk a little bit about kind of what specifically that is?
Definitely. So autism, it's really a range of conditions, and it's characterized by, differences in social interaction, repetitive behaviors, nonverbal and verbal speech. I mean, there are a lot of different things that categorize, autism into different levels of autism. So I believe it was 2012. Maybe don't quote me on that, but that's whenever autism spectrum disorder was coined as an overarching term. So back in the day, they would have autism or autistic disorder. They would have Asperger's syndrome. They would have PDD-NOS, which stands for pervasive developmental disorder, not otherwise specified. And so they had all these different words. And in 2012, they coined them all under autism spectrum disorder as the official diagnosis. So you may know somebody, or you may know a few people on the autism spectrum. Every 1 in 68 children now are diagnosed on the spectrum. So it's highly likely that you know somebody or are related to somebody or have a friend who has a child or so on. You may know 2 different individuals that have autism and are completely different. So it's all based on diagnostic criteria that would place them under the autism spectrum.
Well, I think that's an excellent point. It is all around us because as dietitians, we can help you specifically do these therapies or work with people, but we can by understanding and knowing how that nutrition plays such a role in this condition, we can impact those lives significantly by recommending or influencing changes in diet.
Absolutely. And I think autism and nutrition is a newer field. First of all, there's not a lot of dietitians. And I think that's because there's not a lot of education, training us in autism and nutrition. I never once heard autism, maybe once, but heard it in our curriculum. And probably the times that people did hear it was when I was bringing it up, because that was something I was so passionate about. There is so much that we can do with autism and nutrition. And like I said, it's fairly new. I would say the past, all the research would be mostly within the past 10 to 15 years. And that's really young for research. I mean, that's not a lot of time. So we're continuously looking at new research and trying to figure out what's best for these kiddos.
Brittyn, why does a child with autism even need to see a dietitian? What is it about nutrition that can affect them?
Right. So I would say number one thing would be selective eating. A large majority of my clients have selective eating. In autism spectrum disorder, you also have an increase in your senses. And so this is typically called sensory processing disorder. It's a different diagnosis, but typically runs with autism spectrum disorder. And so what this means is that you interpret all of your senses incorrectly or a higher sensory impact. So let's say that, I'm playing a song on the radio. Well, to me, that sounds, just normal, but to my brother who has increased sensory input for hearing, it sounds terrible and it hurts his ears. He has to wear earplugs, which he does. He wears earplugs on a daily basis because he can hear so well. So when you think about eating, you think about, all the senses that you're getting. It's an overall sensory experience. So you're tasting the food, you're smelling it, you're hearing the crunch, you feel the texture in your mouth and the temperature, you see it. And it's just this whole sensory experience that for a kid that has sensory processing disorder, that can be really overwhelming. And so it's better to just not eat than to be so overwhelmed or have senses that are really uncomfortable for you. And so a lot of times they'll start to revert to unhealthier foods because they have a better sensory profile. So think about eating French fries. I mean, that French fries are salty and they're crunchy, and that's what they are. I mean, they're designed to be very pleasing to us and to be very tasty. So they'll get hooked on a certain name brand because they know exactly what sensory input they're going to be getting. So like Lay's potato chips, they're the same every single time. They're salty and they're crispy and they're thin and they have the same exact taste. So these kids will sometimes get hooked on these unhealthy processed foods that are a neutral color, like a blonde color. We call them the blonde foods because that's also a less intimidating color. So I see kids all the time coming into me that are eating chicken nuggets, French fries, potato chips, crackers, Cheez-Its, because all of those are very pleasing to them and very easy to eat and are not very overwhelming from a sensory standpoint, as opposed to
broccoli,
a salad, or exactly. So it changes every time depending on how long you cook it or what cooking style you use, or if it's in season or not, if it's frozen or fresh. I mean, there's so many things they don't know what to expect, and a lot of times it's not pleasing to them, so they're not going to eat healthful foods. So I would say that would be the number one reason why I see these kids would be for selective eating. So working with them, getting them into occupational therapists to help with this would be the first thing. But there are a few different reasons, and I can go on if you don't have questions about that.
Tell us some more things because another question I had was, what are the common nutrition risks for these types of kids? So what types of nutrition issues do they typically have? So I imagine that meshes with kind of why they need to see you.
Yeah. So from a sensory standpoint, from a selective eating standpoint, thinking about nutrient intake. So this is actually what I did my master's thesis on. It was food aversions and nutrient intake in children with autism spectrum disorders. So thinking about the foods that these kids are eating because of their sensory issues, what kinds of foods are they eating and what nutrients are in those foods? So I mean, if we just think about it, eating chicken nuggets and French fries and chips and Cheez-Its, there's no nutrients. Yeah, there's calories and maybe some protein in the chicken or whatever else they're eating, but think about all of the micronutrients that they're missing. Iron and B12 and vitamin C, vitamin A, whatever else they're missing out on. So there can be a lot of nutrition deficiencies that we pick up in autism too. So that's something that I always want to get done with my parents, is make sure that we get some lab testing to make sure that their child is in the correct zones for many common nutrition deficiencies like vitamin D and zinc and everything else. So
how do those affect behavior?
Well, iron, I see low iron all the time. So it can cause fatigue. So, and brain fog. So if you're fatigued and you have brain fog, you're not going to work your best in school. You're not going to be able to do your best in speech therapy or OT, or maybe that's inhibiting you getting out verbal language. Maybe you just feel so tired and exhausted that you don't want to put forth that extra effort. And also, if a child is nonverbal, they can't explain that they feel this way. So a lot of times this is one of the ways, besides just parents' intuition, that we can get a root cause. A deficiency in B vitamins can cause brain fog and inactivity, hyperactivity. Vitamin D can cause fatigue. Zinc and iron can cause something called pica. So deficiency of zinc and iron, like I said, causes pica, which is craving of non-food items. So sometimes I'll have parents come into me saying, hey, my child likes to eat paint chip pieces of the table and eat them, or eats dirt outside. And a lot of times I'll say, that sounds like pica. So we can get tested. And a lot of times we can get that to go away by using nutrition supplements, because it was a nutrition related problem. So you can have nutrition deficiencies that exacerbate others, that make others worse. So you can lose your appetite as well from zinc deficiency or iron deficiency. So that would make it worse. You have iron deficiency, which makes you not hungry, which makes you eat less, which makes you get less iron. It just becomes a snowball effect too.
Yeah, and I imagine if you've already got the sensory overload process going on, and you're tired, the thought of doing certain things and knowing that's going to also just be doubly effective could be overwhelming, especially to a younger child. So what other things do you see? Because you said the selective eating, sometimes nutrient deficiencies that are causing behavior problems, those can be improved with nutrition?
Definitely. So one thing I will say before I get into that, gut issues are very common in autism, actually are 8 times more likely in a child with autism spectrum disorder than a child without autism. So looking at the gut, that can manifest in a few different ways. So you can have chronic constipation, chronic diarrhea. You can have something called intestinal dysbiosis, which means that there is a higher amount of bad bacteria in the gut than good bacteria. So we know that is related to diet. The type of bacteria that's in your gut highly depends on your diet. So thinking about high fiber foods, fruits, veggies, whole grains, legumes, those are things that grow good bacteria. Bad bacteria feast on sugar and processed foods and animal-based products, things like that. Well, if we take a look at these kids' diets in the first place, what kind of bacteria is their diet feeding? And second of all, in autism, we already see naturally a higher amount of bad bacteria. I think the research is going on that. Why do we see that much bad bacteria in these kids' guts? And yeast overgrowth and other candida and all of these things, thinking about how is diet going to impact that, but also how can we help other things like environmental or nutrition supplements that we could use, like probiotics that could help put some good bacteria into the gut. I would say gut issues is my number 2, next to feeding or next to selective eating. Probably 80% of my clients have some sort of GI issue. And that also includes food intolerances. So I see a lot of food intolerances in kids, not allergies, intolerances with kids with autism too.
You talked a little bit about why a person or a child with autism or family, because I imagine it's the whole family that has to be involved. like you said, it was your mom initially recognizing, but it changed your whole family's dynamic. How are the families involved in the nutrition therapy?
Right. So it is a overall whole family approach, and that can be hard for younger kids who don't understand that, or for even the parents who don't want to make a change. So how these kids get their food, or any kid in general gets their food, is from their parents. So if their parents don't know how to properly cook food, or use the oven or the stove, or steam a vegetable, or even what foods are healthy, it all starts with the parent. So a lot of my counseling can be nutrition education for the parent too, making sure that they know what foods are healthy, what foods should we be avoiding, how should we cook this certain food, or some ideas to give their child for snacks rather than, chips and cookies and everything. So it starts with the parents and then trickles down from there with the other kids too. We don't ever want to single out a child that has an eating issue. We want the whole family to be or that we put on a special diet too. We want the whole family to be following this too, even if it's just at home that they follow it. That doesn't mean they have to follow it outside, but for the better of the child, if they're doing really well on a certain diet, it needs to be a whole family approach so that, they see others eating with them and they have that positive peer model, seeing them eat healthy foods and eat with them too.
So imagine there's a transition period where it's difficult, obviously, to change behavior. Even in my own children, I know it's difficult to get them to even just try new food. I imagine that a child who has an autism spectrum disorder there's a period of time when the family has to kind of test it and trial it and see if it's what the change is going to be. So how do you help parents with that?
First of all, right. So every child on the spectrum is different. So one approach might work for one child really well, and it might not work for the other. So it's important that we always monitor results. And so I help parents with that. I'll give them a form. I have something called a trial response form, and they'll write, how are they doing on, their speech or their GI issues or skin issues or sleep or whatever it is. So we can track it along the way to make sure that we're not doing anything that isn't necessary. Because if I have a child on a gluten-free diet, but we don't see any changes, what's the point? And, if they're not reacting well and the parents, spending all this extra money or spending all this extra time. So I always make sure that it's worth the parents' time too. So there can be a transition period. I am very upfront with my parents saying this is not going to be easy, but it's something that your child needs in the long term. So we're doing this for your child to have the best outcome that they can. So feeding therapy takes a lot of time for a child to learn that process or to get used to trying new foods, or, it's not an immediate fix. It's something that we need to work on in the immediate to affect the long-term process. So it can be hard when they don't see immediate results. Sometimes it just does take a little bit of time for the child to get used to whatever new therapy it is, or for a certain diet to work. It can take a little bit of time. It doesn't happen overnight. I feel like that can be discouraging for some parents to not see it immediately.
Well, and I love that you have a form for them to complete, because a week later, I might not realize that, my son is sleeping through the night, or just not waking up as much, having less tantrums, or, whatever. But that way, I kind of have a baseline. I know where I started, because how quickly we forget what changed. So that's awesome, because that's that kind of encouragement too, when you're looking for something and you're frustrated, to be like, this is very worth it because I've already seen a little bit of change. And it's going to continue.
Exactly. And that's the hope too, that parents will see that they notice a change, even if it's just, small. Like you said, if it's just now they're throwing one tantrum a day versus 5, they're still throwing a tantrum, but it's a lot better than it was. Sometimes it's easier to forget that. Or with sleeping issues, maybe now they're only waking up one time in the night, but before they're waking up every hour. So over time, sometimes we can lose the big picture on how much this is affecting them.
Yes, and just the whole family, the stress level too. You did mention a gluten-free. Can you talk a little bit about some of the diets that are helpful in autism for these kids to, what are some of them that you've seen used that obviously every child is different. Can you kind of talk about that a little bit?
Yeah, so one of the most studied diets in autism is the gluten-free, casein-free diet. So for anyone who doesn't know, gluten is the protein in wheat, rye, barley, or any gluten-containing grain. So gluten-free grains are rice, corn, buckwheat is gluten-free, quinoa. I mean, there are a lot of options. Casein is the protein in milk. So a lot of people get this confused with lactose. Lactose is the sugar. So casein is the protein. It cannot be taken out. So even if you get lactose-free milk, it still has casein in there. The only way to avoid that would be to be on a completely dairy-free diet. So consuming, milks like almond milk, coconut milk, soy milk, other things like that. Gluten-free, casein-free diet would be completely avoiding any food that has gluten and dairy essentially in it, which is a lot of foods, especially if your kid is crackers and French fries and breaded foods and processed foods. It's a lot. So I will make a little tiny note on that. If a child is so selective in their diet and they're only eating foods that contain gluten and milk, I'm not going to put them on a gluten-free, casein-free diet. We need to add foods before we can subtract. That always needs to be something that the parent and a healthcare professional talk about, because we don't want them to become reliant on two foods, because then we're going to cause a nutrition problem anyway. We need to make sure that they have enough foods so that we can put them on a specific diet. So starting with feeding therapy and working our way up with that. I just wanted to plug that little thing in there. So I'm always starting a diet knowing that they can, on the foods they have remaining, they would still be able to support a healthful diet. The symptoms or the pros with a gluten-free, casein-free diet are all over the board. Some kids do really well. And some kids even have withdrawals from milk. A lot of times, so there's a protein, a molecule in milk called casomorphin, and that can be addictive too. So I've even had kids that have had withdrawals, and that seems totally crazy, but I had a mom calling me saying her son, she thought he was going through withdrawals, and a few days later he stopped and had a huge spike in positive behavior and a drop in autistic behavior. I mean, it was amazing. But you try that with another kid and there's no change. It's all dependent on the specific individual. The gluten-free, casein-free diet is claimed to help with social interaction, different autistic behaviors, brain fog. There are so many different things that it could help with. It just depends per the child. So that's another reason why we do the trial response form, to see and monitor if these diets are actually helping, and or if we should try another diet. But I would say gluten-free, casein-free is the most common, most research diet out there for autism.
So what is the idea behind why that works?
So both gluten and casein, when they're broken down in the gut, it's thought that children with autism cannot break them down completely, and therefore they have a reaction to them. Some of the small particles too, they've said that, so there's something called leaky gut syndrome, which would be, all of your tissue in your gut should be completely closed. It should be a closed system, but sometimes things like unhealthy bacteria or yeast or toxins or things like that can damage the lining of the GI system. So there can be tiny little holes. And so they say that these small particles in gluten and milk or in casein can go through that epithelial barrier in the gut and can travel to the brain. So these can pass the blood-brain barrier and can cause poor behavior, brain fog, things like that. So that's the mechanism that they're studying. I believe that the molecule broken down from gluten is called gliadin. Then casomorphin would be one from casein. There are others, but just looking at how that impacts the brain, the whole gut-brain connection too, which is a whole nother area that relates to really any disease anyway. The gut is our second brain. Thinking about how is our nutrition affecting our gut, it affects our brain.
Well, I agree 100%. We had a presentation at the dietetics meeting this last month, and it was Dr. Martindale talking about probiotics and everything they do in your gut, and how, gut bacteria flora changes just even day to day, or flying 14 hours on a plane. And he talked about that barrier and how fiber really helps to strengthen that barrier. That makes a lot of sense. And I think also probably the simpler the diet can be, kind of that removing some foods and then maybe later testing them, trying them again if it helps. But it makes a lot of sense that would be helpful.
So that's a good point. Doing an elimination diet can be helpful too, to identify foods that are offending to them. You can even do food intolerance testing, like intolerance testing, not allergy testing. That would be a different deal, to see what sensitivities your child has to food.
And there's some blood work that you can do, right, to kind of analyze that, not necessarily just with ASD, but people in general.
Right, definitely. So there's a test that I like called the Pinner test, and that's what I use in my practice. They gave me a discount code. I think it's ASD dietitian, and you get 10% off or $50 off. That's what it is. It's ASD dietitian. You get $50 off a Pinner test. They're great.
That's Pinner, Pinner?
Yes. Pinner test. And I use that in my practice all the time. I've used it personally too, and that it seriously changed my life with my migraines. I don't have migraines anymore. All because I followed what they told me to on the test. So I've used that with a lot of kids and has been really successful.
Well, I'll add that in the show notes for sure. Okay, so nutritional supplements that might be helpful. We talked about the fact that these kids can have nutritional deficiencies, and then you can also end up adjusting their diets and doing some, they may have some really strong food preferences. So what sort of supplements do you typically see them needing?
So I would say a good starting base, if we don't have any labs yet, we've talked about probiotics. Those are always a good thing. Probiotics, fish oil is good. And then actually there's a ton of research with autism and ADHD and, omega-3 oil and fish oil helping with cognition and autistic symptoms. And then lastly, a multivitamin. Especially if the child is selective in their diet, they're most likely not getting the nutrients they need. So those three are solid to start with. And I have specific ones that I prefer based on, what, like if a child can only do a liquid or a gummy or whatever else, I have specific recommendations specifically for, these kids. So I start with those, and then additionally want to get nutrient testing. So making sure, like I said before, all of their lab values and seeing where they are, and then we can go from there. So if I notice they have a vitamin D deficiency, checking to see, how deficient are they and how much should we supplement extra, or if they're iron deficient or whatever else. And then I create a supplement regimen for them based on the appropriate timing for mealtime and taking the supplements, or the best time for absorption for iron or probiotics or whatever it may be, so that we can make sure they get the most out of the supplements.
What types of issues as healthcare providers, listeners, maybe dietitians, nurses, doctors, or just students, what types of issues should healthcare providers look for to know if a child on the ASD spectrum needs to have nutritional intervention?
Yeah, that's a great question. So there is this course, and it's also a conference that I went to this past year, and it's called SOS Method to Feeding. And it teaches you the difference between a picky eater, because I feel like that's almost the only terminology that we know to use. We say he's a picky eater, but there's another step that's actually a step further than that, which would be problem feeding. And so Dr. Kay Toomey is the one who runs this course, and the whole SOS method to feeding. So, a picky eater would be, maybe they have a decreased range or variety of foods, like 30-ish food, 30 or more foods. They'll lose some foods, burn out on them, but about 2 weeks later, they'll probably re-add them back to their food repertoire. They eat at least one food from all nutrition or texture groups. they can tolerate new things on their plate, things like that. They're picky eaters. Problem feeders, they have a restricted range or variety of foods and usually eat less than 20 foods. I see kids all the time that have less than 5 foods. So working on adding new foods to their diet, because nobody can survive healthfully on 5 foods. And then foods lost due to a burnout, they usually are never eaten again. They will not consume them later in life. They just burn out on them. They will refuse entire categories of food like texture groups or nutrition groups, like completely avoiding vegetables or whole grains, liquids. Another thing would be, eating food with the family. A lot of times they will not tolerate what the family is eating at a regular mealtime. They'll need to be cooked a separate meal. So these are all things that would fall under problem feeders. So a practitioner that's working in autism spectrum disorders, one, it would be good to know about SOS method to feeding because feeding is such a common issue, but also being able to identify the difference between a picky eater and a problem feeder, because that can definitely give us an idea of where we should take their therapy, what route should we take. So I think being able to discriminate between the two would be very helpful.
Okay, that's great advice.
If they just had to choose one thing, if they notice a kid is eating less than 20 foods, that's red flag. They should be eating more than that. So even if they can't memorize all that or take the course, if they notice less than 20 foods or they're avoiding a complete food group, that's 2 red flags. I would just send them to a dietitian to be sure, just get an evaluation. If the dietitian says, no nutrition problems, they're just picky eater or whatever it may be, great. But they've got an entire eval that they can do. And, we're looking at other nutrition issues rather than just how many foods are they eating, but it's a good red flag.
So many problems come from the deficiencies that are the result of the problem feeding. If you can address those sooner rather than later, you don't end up having as many problems. A little easier to adjust. Who do you think is best suited to this type of change or process that we're talking about? What types of patients are you seeing that you see the biggest impact with?
I think you'll hear this with any therapy with autism. I mean, the younger, the better, because if we get them into early intervention, we're able to help form those behaviors that they're going to use down the road. As if, working on feeding therapy with a child who's 3 years old and working on introducing new foods at that point versus trying to introduce new foods to a child who's already very set in their ways, 12 or 13 years old, that can be more difficult. Well, it can still be done, but it's a lot easier if your child has a feeding issue and you can identify that starting as early as possible. As soon as parents are aware, I would go ahead and get on a waiting list or get in to see somebody so you can make the most changes you can early on.
Okay. What do you think is next in this field of autism and nutrition that's coming up, and how do you think it's going to affect healthcare in the future?
So something that I've really seen, which is exciting for me, is I think the access to genetics. And so one thing would be 23andMe or Ancestry. You can spit in a little vial and send it off and they'll tell you your entire ancestry or all of your genes. And it's so interesting. So that's something that they're really looking at is genetics in autism and trying to see if there is a genetic component to it. What you can do with 23andMe, it tells you, I use this all the time with my clients. First of all, it gives you some really interesting information about ancestry and if you're a carrier for any genetic mutations like cystic fibrosis or whatever else. They'll tell you if you're a carrier for any of that, which is nice. What it can also do is they'll break down and show you different genetic mutations that could impact the way that you absorb nutrients. In 23andMe, I will say you have to download your raw data, and I help my clients do this. So download the raw data, and then I can put it through a system that will show them these specific genes based on their raw DNA data. So it can tell me, okay, instead of taking 500 IUs of vitamin D per day, they have a double mutation on this vitamin D gene, which first of all means we should get it tested to make sure that their vitamin D is in range. But second of all, maybe we need to supplement higher than we would the typical child because they have a genetic mutation here that is changing the way that they absorb vitamin D. So that's just an example. But I think genes and nutrigenomics or nutrigenetics, which is the way that our genes respond to nutrition and the way that, all of that is absorbed and metabolized. So I think that all of that is very, very interesting. And I think there's a huge area coming up in this field that is going to be explored. You'll see a lot of research looking at this as well right now.
Yeah, I think we're going from general diets or overarching recommendations, diabetes, you should follow this amount of carb, this amount of protein, whatever, to going more towards this is what genetically your body needs to adjust to. So being more personalized, and it's much easier to now because we have these tests that we can do. We have this information. Medicine can be specialized. Even, cancer treatment, everything.
It's really interesting. Yeah, really exciting. So that's definitely an area that will be growing with autism. I can guarantee that.
That sounds great. What are some ways that listeners who are interested in this information, how can they use this information in their daily life? How can they make changes or affect? You said 1 in 68 kids has autism or an autism spectrum. How do we use it in our daily lives to use it?
So I would say, well, first of all, just increasing knowledge about autism is always the best thing because it is so common now. And it just continues to get more common and more common. Making sure that we educate ourselves and then educate our children too, because this is just another plug, but there can be a lot of issues with bullying in the schools. And I think it's because kids just don't understand. So I think starting with just understanding a diagnosis, talking to your kids about it. My mom used to go into my brother's classroom all the time and educate his classroom about autism and what it is and how they should interact with him. And it helped so much just because they understood what was going on. So I think, first of all, just autism in general, how we can learn to, accept people who are different from us and have different abilities as well. Second, looking at your own health. And we don't know cause of autism. A lot of studies are looking at maternal values of vitamin D or folic acid or folate, I should say, or other nutrient deficiencies in pregnancy that could possibly contribute to it. I think that's a genetic and environmental cause. I don't think there's one specific cause. So thinking about your own nutrition when you're having children, making sure you're doing the best thing for your body based on genetics. If you have that information available, being as healthy as we can to, give our offspring the best chance to, be perfectly healthy. So
great advice. Brittyn, last question. What's your favorite food? Has nothing to do with autism.
I love Thai food. I love Thai food. I love Vietnamese food. Any Asian food I could go for. I think pho is my very favorite. I love lemongrass tofu pho. There's this really great place in Norman, Oklahoma, and it's called Coriander Cafe, and they have the best pho. It's amazing. But I also love yellow curry with brown rice. It's so good. So any type of Asian food, I would be so down for anything.
All right. Well, this has been awesome, Brittyn. Thank you so much for being on the podcast today.
Thank you so much for having me.
It was a pleasure to have you on the show. I know my listeners have learned a lot about nutrition and autism and how we can make a difference. And I hope you'll be open to coming back again in the future and talking some more. If listeners want to connect with you, what's the best way to do that?
They can. I have Facebook, my website. So on Facebook, it's just the Facebook page, Autism Dietitian. And then my website is autismdietitian.com. There's a contact tab where you could click to contact me, or on Facebook, you can always message me on the Autism Dietitian page. I also have Instagram. It's just at Autism Dietitian. Pretty easy to find.
Well, guys, this has been another great episode of the Nutrition Experts Podcast, the podcast that is all about learning more so you can do more with nutrition in your life.
You've just listened to an episode of the Nutrition Experts Podcast. Be sure to get more information about this week's episode at www.nutritionexpertspodcast.com. Tune in next time for another great conversation with a nutrition expert and expand your personal knowledge in the field of nutrition, one conversation at a time.